Hi, I'm Dr. Rutuja from Parency IVF Hospital. Today we are discussing an interesting case. A young couple, 32-year-old wife, 34-year-old husband, which came to us with a non-consummated marriage with multiple IUI failures and a laparoscopy done with a marriage of 5 years. This is a very interesting case because it was really challenging. Patient had PCOD with oligoasthenoteratozoospermia. Husband was alcoholic and a smoker. With lot of lifestyle modifications, 3 months of proper antioxidants, counseling and treatment, we started the journey of IVF for this couple. In first pickup, patient had good number of embryos which were frozen, and then patient's embryo transfer was done. Patient conceived in first attempt. Patient had history of twinning. Unfortunately, patient had a triplet, and patient was not that ready to carry a triplet, and we also thought carrying triplet was not that safe and she would end up into a preterm. So we decided at the end of 12 weeks, after thorough genetic screening and quadruple marker testing, we decided that a couple will go ahead with a fetal reduction. That is, from triplets we reduce the pregnancy to twins. The reduction went uneventful, but after 1 month of reduction, patient came to us with history of fever. The fever was not responding to any medications over the period of next 72 hours. Fever started spiking to 104, 106. Patient was diagnosed to be pyrexia of unknown origin. But with the history of prior reduction just few weeks ago, we were really suspecting whether it was chorioamnitis or whether it was some infection. That was a COVID time. So patient's COVID test was negative, but still fever was there. Patient was shifted to a higher center under the vigilance of a physician and an intensivist. Patient's management was started on the lines of pyrexia of unknown origin, with keeping COVID on a question mark. Patient was given all the required treatment to save the mother rather than the children, though mother was not consenting for the reduction or the abortion or termination of the pregnancy. But unfortunately, due to fever, patient lost her second baby also. Then patient was left with a singleton baby after spontaneous reduction of the second one. Then at the end of 5th month, patient ended up into a spontaneous labor and she expelled a preterm baby, and she lost her third baby also. After this, patient was completely disturbed, and then patient also lost hope, and we thought at least we could save the mother, and patient took a break of 3 years. After 3 years, with lot of hope and lot of focus, the couple came back to us for the second chance. And with prior thorough checkup and detailed understanding, we planned to go for another IVF cycle. When another IVF cycle was done 3 years apart, again the situation was same, PCO with oligoasthenoteratozoospermia. Only better factor was husband now was completely non-smoker. He had quit smoking from past 3 years, and husband had absolutely reduced his drinking also. So the quality of sperms were better, and we did a pickup, and this time we decided that we will do a pre-genetic screening and do a single embryo transfer, though keeping into mind that she has a history of twinning and embryos may divide still. And then we did a embryo transfer, and patient conceived this time again in the first embryo transfer only. Now patient is going through 4th month of her pregnancy. No complications as of now, but patient, due to her increasing age and the stress she has gone through, now patient has developed gestational diabetes mellitus, which is strictly under control by diet and metformin. As of now, till the early anomaly, patient is doing fine, and we are hoping for a better outcome with an in-hand baby this time. Thank you.